Hello, this is Dr. Mercola, and I'd like to talk to you today about cholesterol. Why? Because there's so much confusion about this issue, and I'd like to really provide you with some solid information that you can review and examine and carefully evaluate and make the decision whether or not it makes sense to you. Now, when I first started practicing after my family practiced residency in 1985, and I started screening for this, and I told people that they had elevated cholesterols, I was a new kid on the block. They took their lab test back to their old doctor and they said, oh, no, you didn't have high cholesterol. That was because the reference ranges in 1985 for cholesterol were over 330, 360. So if you had a cholesterol of 310, you had normal cholesterol. And no one thought otherwise, or very few people did. But my focus and passion was preventive medicine even back then. And so I was using total cholesterol as a risk factor. And of course, you know, my views have changed since then. But I just want to mention that story to you that things have changed. And why did they change? Well, they changed because later on, the drug companies actually developed the technology to make a drug called statin drugs. And these statin drugs very effectively reduce your total cholesterol level by impairing an enzyme in your liver, because your liver is what makes cholesterol. They impair this enzyme, so your total cholesterol levels reduce. And as a result of that, they've got a solution. They've got a way that they can sell you something that will work until you're dead for decades to lower your cholesterol. And it doesn't solve the problem, yet it generates tens of billions of dollars of revenue for them. So that's why there's been this tremendous push to identify cholesterol and to treat it. So, you know, and they treat it to ridiculously low levels, because ideally your cholesterol should not be 150. I believe it should be about 200 or so. And when you have a cholesterol 150, it's too low, because cholesterol is an important element of your cell membranes and is a precursor for your steroids. You need cholesterol. So you don't want to lower too low or you're going to have problems. So it should be about 200. Now, there are ways to lower it, and I'll talk about risk factors that, other than total cholesterol, as I mentioned, that are even more powerful to predict whether or not you're going to have heart disease. And let me tell you what those are. It's your HDL to total cholesterol ratio. Both of these blood tests I'm going to describe about are fasting tests, which means they're fasting for 8 hours or more, just nothing to drink but water, or drugs or supplements, and you take that and you get the results. Now, the HDL to total cholesterol ratio should be above 25%. In other words, a quarter of your good cholesterol should be good, or higher. I mean, I've seen people as high as 50%. Half of their total cholesterol is good, and that's even better. That's associated with hyperlongevity syndrome. The other thing you can do is your triglyceride to HDL ratio, and that should be below 2. So if these numbers are distorted, you're at pretty high risk for heart disease. Not only heart disease, but cancer, arthritis, diabetes, you know, all these other conditions that result from the primary cause of why your cholesterol is going to be elevated to begin with. You know, I've treated tens of thousands of patients, probably somewhere between 20 and 30,000 patients. And in my entire practice, I've only put 5 people on statin drugs once they understood this. 5 people. And that was because these people had what I believe is the only condition that warrants the use of these drugs, which is familial. It's a genetic condition called familial hypercholesterolemia. It's about 1 in 10,000 people have this, and usually the fasting cholesterol levels are way over 330. So, and it's almost impossible to control with diet and exercise. So that is my strategy and recommend. So ideally, what happens to the other 999 or 9,999 people with high cholesterol that have it? Well, those people, it's usually a result of elevated insulin levels or a decrease in your insulin receptor sensitivity. And these are both related to 2 primary things. One is the foods that you're eating and your exercise program. So that will dramatically affect your insulin receptors and your insulin, subsequently your insulin level. Because when your insulin levels are high, your cholesterol level goes up. So you want to normalize your insulin levels. Now, your fasting insulin levels, another good test, it should be about 2 or even up to 3. So that's where you want, that's what your goal and your target is. So these are the strategies, and these are the ways that you can do it. And ideally, if you have some other elements that you can use, is nutritional typing. We've recently adopted this test and offer it now for free, and that's a system that has helped you design what food identify what food you're designed to eat. You could be high fat, high protein, low carbs, and this diet may actually radically lower someone's cholesterol. But that same diet, given to a person who's a carb type, designed to eat high carbs, low fat, low protein, will raise their cholesterol. So you really need to eat the foods that are designed for you, and this test will help you identify it. And again, it's free, and there's a link for that on this page. The other thing you want to do is to make sure that you're taking omega-3 fats, animal-based fats, like DHA and EPA. And traditionally, I'd use fish oil, but I've since learned and actually reviewed some interesting studies which are unpublished at this point, so I can't show you a link to them, that show that at 500 milligrams, krill oil will actually raise HDL levels and lower triglycerides and total cholesterol far more effectively than fish oil, which is absorbed at a much lower rate. You know, because the fish oil has the DHA and EPA in triglyceride form, and your body has to digest it, break it down, reassimilate it into the phosphatidylcholine form, which is already the form it's in krill, to get the same thing. So ultimately, you're getting like 15 times more effective milligram per milligram of DHA and EPA in krill than you do for fish. That's why you can see these dramatic benefits. Powerful, powerful strategy, and I definitely would incorporate it. But then again, the exercise. We developed a program called Peak Fitness, and I'll put a link to that on this program so you can do it. It's a comprehensive program. We have stretching, flexibility, strength training, sprint cardio, or Peak 8, where there's this high intensity exercise where you're pushing towards maximum heart rate and then recovery, and repeating this about 8 times. Powerful way to increase growth hormone, improve your stamina in general, and decrease your risk for heart disease overall. So these are powerful strategies that you can use that really address the foundational reasons as to what's causing it. Why do you want to rely on drug companies for an expensive solution that's potentially toxic? So if you or if your family or anyone you know is on a statin drug, it's really important to understand that that statin drug will non-specifically not only lower your body's ability to manufacture cholesterol, but it will also lower its ability to make coenzyme Q10. And CoQ10 is really a crucial enzyme that your body needs for the production of energy and a variety of other functions. And if it's lowered artificially by taking a drug, you will clearly accelerate your death rate. So if anyone is taking this, it's important to be on coenzyme Q10, or even better, something called ubiquinol, which is the reduced version of CoQ10. I've written and done a video about that before, but essentially, if you're over 20 or 30 years old, your body's ability to make this reduced version decreases. So if you're younger, you don't need to take that. Coenzyme Q10 is more than sufficient, and it's relatively inexpensive, and that's the one to take. But if you're older, definitely encourage the ubiquinol, because this is really crucial information. It can really save someone's life and a lot of grief. So hopefully this information has been helpful. There's a lot of confusion about cholesterol, and hopefully I've cleared up some of it. Definitely read the other articles that we have here linked, because there's further information and details that I didn't have time to go into in this video. But it's hopefully information like this that will give you and your family the practical tools that you will need, the information to discern and break through the hype of the drug companies, to understand what it takes to properly take control of your health.